Hi everyone, welcome back to my channel. My name is Alex and today I'm going to be talking to you guys about the different treatments that I have done and why I chose the ones that I did choose, and I'll talk about other treatments that are available for primary ovarian insufficiency. If you're new here, primary ovarian insufficiency is a serious endocrine disorder. It's where the ovaries do not function normally. They either completely shut down or they function suboptimally. The current consensus is that this is because ovarian reserve is low, which means you have few eggs left in your ovaries. There is new research coming out that suggests that that might not be the case, and I will get into that as well. So I'm just going to be chatting with you guys casually while I'm getting ready and talk to you about this, and just know I'm going to gather like a whole bunch of studies, or at least a few studies on each topic that I talk about, and I'll try to make sure that these are peer-reviewed studies. I'm also going to link a video for you guys called Postnatal Oogenesis by Amy Raup. This talks about the research that's coming out about women's ovaries. They've actually found ovarian stem cells in the ovaries of women, which counteracts the current accepted dogma that women are born with all the eggs they will ever have. That's actually been found to potentially be false, and that women can actually produce new eggs after birth. Let's go ahead and get started. That's basically where we're starting. In the field of reproductive medicine, you're either considered an ovarian pessimist or an ovarian optimist. An ovarian pessimist essentially believes that women are born with all the eggs that they will ever have. This does not make a lot of sense from an evolutionary perspective. Please bear in mind, I am not a scientist or a doctor, and I am talking about this in layman's terms. This is just all the research that I have done. I am not a doctor, and I recommend that you do your own research. I will provide you with research that I have read, and you guys can read that and draw your own conclusions. I am not trying to create false hope for anyone. I'm an ovarian optimist, which means that I believe that ovaries can create eggs after birth. And so again, in reproductive medicine, you're either considered an ovarian pessimist or an ovarian optimist. Most people, most doctors, most scientists are ovarian pessimists because that is the accepted dogma, and anybody who really goes against it usually gets pretty heavy backlash. But we're constantly learning new things, and I think it's important to look at the research and realize that there are over 80 studies that have found these ovarian stem cells with the potential to create new follicles, and there are only 10 that couldn't find them. I would tend to believe the 80 over the 10. So anyway, since I believe that it is possible for the ovaries to create new eggs, I believe that my body can heal. That's essentially where I stand, is that I believe that my body can heal and that I can regain my ovarian function. I'm not just gonna wait around for that to happen. I have changed my diet, I have changed my lifestyle, and I have incorporated a lot of things to help detoxify my body. But I'm not just gonna wait around for my ovaries to start working normally again, so I have done other treatments to try and help speed along that process. One of the treatments that I have done is only supposed to last for a certain amount of time, and I will get into that. So the fact that I believe that I can heal explains why I chose this first treatment option, which is I decided to go to a functional medicine doctor to try and heal my gut. The gut is sort of the foundation for your entire health, and I had very poor gut health. I did a comprehensive test about what was going on with my gut, and we found out that I had numerous different infections, and things were just not, optimal. So I did a functional medicine protocol with my functional medicine doctor to heal my gut health, and that has made a really big difference. I'm still really new to having my gut completely healed. It hasn't been that long, so but while I was treating the infections, I started to have some irregular cycles, and then as soon as I finished the treatment, my cycles went regular again. So over the past 2 years, since I was diagnosed with primary ovarian insufficiency, I have had pretty regular periods. They usually come every 26 to 28 days. I have consistently had signs of low progesterone, so that is something that causes spotting and things like that. But as far as the frequency of my periods, they have always come every 26 to 28 days. So that has been, something that has stumped some doctors, the fact that I was diagnosed with primary ovarian insufficiency when I was still having regular periods. But I mean, I had all the markers. I had low estrogen. When I got tested, I had low estrogen. I had very low AMH, and I had high FSH. So those are generally the 3 hormones that they look at most. Sometimes they'll also look at LH and like prolactin to make sure it's not originating in your pituitary. My period started to regulate again, and then my functional medicine doctor also prescribed me IV ozone therapy. This is still looked at very critically. It's not an accepted treatment in conventional medicine, but in the functional medicine community, it's used to help detoxify the body. It essentially super oxygenates your blood and helps with healing processes, and there are lots and lots of studies on this, and in Europe they use it a lot more. So here it's not really a thing. It's not approved by the FDA, but it can be really beneficial for a lot of things, and I will put some of the studies about IV ozone therapy in the description below for you guys to look at that. And I did that for a while, and I was still having like the spotting, and also, you know, we are trying to get pregnant, so I was still not getting pregnant. I was also still spotting and just having the symptoms of low progesterone. Like I would get really bad heart palpitations in my luteal phase, and I still am getting those, but they're way less than before. And so my functional medicine doctor recommended me to do IV exosome therapy. Well, IV exosome therapy has been studied for primary ovarian insufficiency, and I will put that also in the description below. There have not been very many studies. It's still a very new treatment, but so far it has shown really promising results for primary ovarian insufficiency. I think the studies have mostly been performed in mice or rats, but they are very biologically similar in how we work, and that's just how science works. They usually do the tests on mice and rats first, and then they move to human trials. So there might be some studies in humans. I can't remember, but if there are any, I will put those in the description as well. So I did those. We did 1 round before I went to do adipose PRP, which I will talk about in a second, and then we did 1 round after. This can take a little bit to take effect, and also they can have really poor homing capability. Generally, the body will release signals of inflammation. The exosomes will kind of migrate there, but it can happen that a lot of them like end up collecting in organs like the liver and the lungs and things like that. But even still, like despite that, there has still been success with IV exosomes. So that is really amazing, and so I did those. That's why I chose to do that, because exosomes can help repair different tissues. They increase the communication between cells, and it just helps to regenerate damaged tissues. And while I'm talking about damaged tissues, I just wanted to let you guys know, if you haven't seen my story with POI, watch that. I talk about the fact that I was exposed to different chemicals and mold and things like that when I was living in New York, and that's why I think that I got primary ovarian insufficiency. My premenstrual spotting started right around the time when I was exposed to all these different chemicals. So within like a few months after being exposed to them. So that's why I think that I got this. There are studies showing that women in China exposed to bedbug fumigation came down with POI afterwards. So the pyrethroid chemicals that they use to fumigate bedbugs have been linked to primary ovarian insufficiency, and I just think that the timing and the fact that the spotting started, I think it's too many coincidences. Ozone helps to detoxify the body. The exosomes help to regenerate tissues that have been damaged. The chemicals that I was exposed to, mold chemicals that I was exposed to, I think is what ended up damaging my ovaries. Those were 2 treatments that I thought would be good to try, just in case, you know, they're able to heal my body. Even if just doing the 1 treatment won't maintain my ovaries working normally, doing it, you know, every once in a while, I can live with, you know, because it's expensive, but it's not out of reach for me. So if I have to repeat it like once in a while, I'm okay with that. The adipose PRP is quite a lot more expensive. It's also supposed to be more effective. Now, why did I choose adipose PRP over regular PRP? Regular ovarian PRP has been being used for quite a lot longer than adipose PRP has been around. Adipose PRP is very new. It's basically combining your stem cells with your PRP, and it's still being studied. So it's not like an accepted form of treatment. Neither actually is regular PRP, but just adipose stem cell PRP has been around for way less time than regular PRP. So regular PRP is great. It can bring women out of menopause temporarily. It can increase your ovarian reserve. It can increase your AMH. It can do wonders for your hormones, but those effects are usually short-lived. They usually only last for about like 3 months, from what I understand. Regular PRP is great if you want to get it done and then immediately go to IVF and like bank embryos or bank, freeze your eggs or things like that. Regular PRP is really good for that if you don't care about like your hormone levels and you're okay with just doing hormone replacement therapy or that sort of thing. I wanted something that was going to last longer. I wanted something that was not just going to help me get pregnant, but that was also going to help heal my body and my hormone levels better and make me suffer less from the lack of hormones that I was having, because I have basically just done like a very low level of progesterone replacement therapy, and it's not really worked for me, and I would need something stronger, or I could do this treatment, the adipose PRP, and it lasts for about 8 months to a year. So it is quite a lot more expensive than regular PRP, but in my opinion it's worth it, because not only can I go and do IVF and create embryos or freeze my eggs, but I can also have my hormone levels back, and I can, without having to take hormones to replace them. So now I'll talk more about what regular PRP is and what adipose PRP is. So PRP is a platelet-rich plasma, and they essentially draw your blood and then they centrifuge it. They extract your platelets, your growth factors, and all that sort of thing, and then they inject that into each of your ovaries vaginally under ultrasound guidance. So they puncture through your vaginal wall and inject into each of your ovaries. And again, this treatment is great. They use it a lot in like sports medicine to heal people from sports injuries or just any kind of like injury. It's used a lot in musculoskeletal sort of things, and the effects are usually lasting with that sort of application. But the ovaries, it only tends to last about 3 months, unfortunately. And I was originally going to do it. I had, I think it was a year and a half ago, maybe even 2 years ago, I think that I had it planned to do it. And it was like the day before we were going to leave to go and get this procedure done. And the clinic called and canceled on us last minute because the doctor that was going to perform my procedure had just stopped working there the day before. And so we were like, okay, well, I guess we're just going to take this as a sign and not do it for now. And just at the time, I was really focused on changing my diet and lifestyle and trying to heal like that. When I first found out I had this, I was not crazy about doing really crazy interventions and stuff. I just wanted to see if diet and lifestyle could do anything, which it did. It helped to regulate my cycles, because when I was diagnosed, my cycles were really were quite irregular when I first got diagnosed, and the diet and lifestyle really got me to having a period regularly. And I say they were irregular, and that's because all my life my period's been like clockwork. I could predict it down to the day when it was going to start, and they started to be sometimes really short, and then they would be longer, around 30 or 35 days. I think 35 days was the longest cycle that I had, but that was right around when I was diagnosed with primary ovarian insufficiency. I decided not to do the regular PRP, and then I found Amy Raup. I'm linking her video on postnatal oogenesis in the description. I found her, and she works a lot with a doctor named Dr. Murphy, who is the doctor who performed my adipose PRP. And I found Amy Raup. I joined her e-course, and I with that e-course comes a support group community, and there were a lot of women getting treated by Dr. Murphy, and I heard really great things. and he's really into the regenerative aspect. He works with really difficult cases, and so I started following him. And when he started doing this adipose PRP procedure, I heard about it and was so excited because I thought it could be, you know, if all else failed, then I could try this and it might help me heal, or it might at least help me to have a baby with my own eggs. And because up until this point, every reproductive endocrinologist I had spoken to said, yeah, we could try with your own eggs for one cycle, but really probably you're gonna have to end up going to donor eggs. So I found out about the adipose PRP, and essentially what they do with adipose PRP is they take a little bit of fat from your umbilical area and they do like a tiny bit of liposuction to remove it, and then they extract the stem cells from that fat. And then they mix it with a platelet-rich plasma, or they put you under anesthesia, they draw your blood and create a PRP, and then once you're under, they extract the fat, the stem cells, and then they mix the stem cells together with the PRP, and then they inject that again vaginally into each of your ovaries. And so my husband and I flew to New York and I got that done, and it has been it'll be 4 weeks tomorrow, so it's been about a month. And I can't really tell you yet how the effects have been because I'm still waiting. I do have a very strong issue with looking at my blood test results and ultrasound results because I have so much trauma from being blindsided with this diagnosis that I just can't bring myself to look at it. I will keep you guys posted when I know. I'm not gonna look at those results, and I don't even think that they would tell us very much yet because the cycle that I am on now was already set in place before I got the adipose PRP. It's basically how biology works, how our bodies work. This cycle was kind of set into place before I got the PRP, so I can't really tell you. But one thing that I can tell you is that my heart palpitations are better this time. I have also cut out coffee, so that might be why. But I also am not having as bad of dry skin as I usually get. Like I usually get really bad dry skin on my palms and my luteal phase, but that's not happening either. Other than that, I can't really tell you guys very much about the effects yet, but I promise that you guys will know when I know. Beyond adipose PRP, there are some new studies happening. The same doctor, Dr. Murphy, who does the adipose PRP, he's doing adipose PRP in the US. He has just opened up a clinic in the Bahamas where he is doing stem cell and exosome injections into the ovaries and not mixing it with PRPs. He's not using the patient's own stem cells or exosomes. He is using from banks younger stem cells and then exosomes. And I've been following some of the women who have done those, and so far I think both women who I follow who've done these, I think both of them did the stem cells and both of them had success with it. So one of them is a bit younger than the other. So the younger one had she was having like maybe one follicle, maybe none, some months, maybe two, some other month. That was about what she would have. Now she is doing IVF with Dr. Murphy, and she has 10 follicles developing at once. So that is really, really unbelievable. Again, that treatment as well is supposed to last about a year, I believe, but we'll see. It's still very new. It's even newer than adipose PRP. So he's still studying that as well. I'll leave a link to RFC so you guys can look into it. You can contact them. Dr. Murphy is really amazing. They are very responsive. So if you have any questions, you can email them and ask them questions. As far as any other treatments, I encourage you to go and look at clinical trials and just Google clinical trials. There are several databases that track different clinical trials that are ongoing. And I believe there's one that's doing IV exosomes on women, but they had to pause it because I did contact the head of that study. But if you want to look for more treatments beyond what I've mentioned, I definitely recommend going and looking at the clinical trials database and then just typing in premature ovarian failure or primary ovarian insufficiency and just checking on those. They each have their own sort of requirements. So some of them, like I didn't qualify for because I'm still menstruating. Some of them want you to have not had any period for a certain amount of time. So, but some of them don't care about that and they just want your hormone markers. So, anyway, I just thought I'd mention that just in case you want to dive even deeper and see what's out there, because usually I think you can take part in clinical trials basically free. There might be some cost associated, like with travel, or I don't know if anesthesia is required or something like that. Then there might be a small cost associated with it. But I also saw one that was looking at Neupogen. Neupogen is usually used in cases with unruptured follicle syndrome, luteinizing unruptured follicle syndrome, LUFS, where you are producing all of the hormones and stuff, but your follicle, the outer shell, is kind of hard and it doesn't effectively ovulate. So it's usually used for that. But anyway, they're using Neupogen. They're trying Neupogen on women with primary ovarian insufficiency. I think that one also might be closed. But anyway, there are studies ongoing throughout the world, so just go and check. So that's it for this video, guys. Thank you so much for watching. I really appreciate. I hope that I answered all of your questions, and if you have any more, please drop them in the comments. I do try to respond to everyone. I am so grateful that you guys are here. It was really hard at first to open up and share about this. If you have been through this, you know how difficult it is to share. You don't even want to admit it's true to yourself. And just talking about it feels embarrassing for some reason, which it really should not. And I just want you guys to know, if you're going through this, I feel you and I am with you. My heart is with you, and you are amazing and you are brave and you are going to get through this, and life is going to get better. And I just want you to know I'm sending you so much love and holding you guys in my heart, and I'm so grateful to be able to accompany you through this and to hopefully make some small difference in your life for the better. I am so grateful for the opportunity to be able to do this and to be able to connect with you guys, and just thank you for being here. Go ahead and subscribe if you haven't already so you don't miss out on my results, and I hope to see you guys in the next one. I love you guys so much. Thank you so much for watching. Bye, guys.